performing hand hygiene. Hi Eva, I'm Stephanie. I'm going to be your nurse today. And then if there's a curtain here, I provide privacy for the patient. Can you tell me your name and date of birth? I'm going to look at your, let me see your patient band. What's your name?
Eva.
And then Ava, do you know your birthday?
Mama Burke.
October 7, 2012, right?
12 D.
Yeah, good job, honey.
What's
Okay.
that?
Do you have any allergies, Ava?
Yeah.
No, right? Say no allergies. Okay.
No.
No, all right. Ava, do you know why you're in the hospital today? You're sick? Okay, baby. All right. Ava, I'm just gonna ask you a couple of questions and I'm gonna do an assessment on you if that's okay with you.
Yeah.
Do you know, so you know we're in the hospital today, right? So we would assess the patient. Assess the patient for orientation, person, place, time, and situation. Thank you. And then when I'm checking the armband, I'm assessing the patient for temperature, and then you can check the pulse too quickly as well. Let me get down to your level, Ava.
Yeah.
So then, you know your name and all that. Ask those questions. Ava, I'm gonna take your vitals if that's okay with you. I'm gonna check your blood pressure. I'm gonna take your temperature, check your heart rate, respiratory rate, and I would check your pulse, your blood pulse ox. All right, let's do your blood pressure. Can I see your arm?
What? What?
No, it's okay, baby.
Okay.
Cover yourself. Let me see your arm.
It's up.
Yeah, we're gonna turn it on.
It's up.
Mm-hmm. Hold on, Ava.
What?
It's gonna give your arm a little hug, okay?
Oh no.
No. Don't move.
A hug.
It's gonna hug your arm.
What's this?
Mm-hmm. Sit still, baby.
What's that?
Yeah.
Harper.
Mm-hmm. Can you sit still?
Mom,
Wait, baby.
I take off.
In a second, okay? 5, 4, 3, 2, 1. And almost. Okay, that's not accurate. All right, let's say that I got the normal reading that I got earlier.
I did this one. I did this one.
So earlier I got 107 over 50. Yeah, all done that one. And then I'm going to take your temperature.
No.
Oh, it's okay. It's really quick. Can you hold your arm down like that for me?
What's this?
This is for your temperature.
Me.
Mm-hmm. We can do mine. We'll do mine later.
What?
Hello again, everybody. We are going to work on some sound activities now for our virtual learning. So everybody, I need you to reach up to your ear and turn them on. Turn the volume way up so you can listen to what sounds we're going to make. The first thing we're going to do is we have these pictures here, and we're
I
going to
did this
figure
one.
out your beginning sounds using my awesome alphabet.
All done that one.
I brought this
All right,
chart
so then I
to
would
my
have
home,
checked
so
your
I
pulse
can read to you
oximeter,
now. So we're
and
going
then
to start out our first sound.
I'm going to check your pulse.
That we're listening to. Okay, it's nice and close. Look at that. You see what that is? That is a ring. Do you hear that?
Rain.
So now you're thinking and you're looking at all of our letters. What pocket should the picture ring go in? I'm going to give you a couple choices. I'm going to give you 2 different choices. I'm going to use this, and we're going to see,
This one.
R and I see S.
Okay, so I've got 68 as your pulse,
Ryan.
which actually matched what I had on there, so perfect.
Ryan. Ryan.
Yeah, can I turn that down for a sec, honey? Can I just turn that down for a second? Ryan.
Yeah.
Yeah.
Ryan door.
Hold on, baby. And so then I would check her respirations. It's kind of difficult right now. Okay. All right, Ava. Ava, are you having any pain?
Yeah.
You're having pain? Okay, on a scale from 1 to 10, if 10 is the worst pain you've ever experienced and 1 is pretty minor pain, could you tell me rate your pain for me?
What?
Scale 1 to 10.
To what?
Okay, all right. So 1.
1.
Okay, baby. All right, honey. So then if Ava was on any oxygen or any tubing, if she had an IV site, I would assess the site and make sure everything's connected appropriately. If she had oxygen on, I would... Hold on, honey. If she had oxygen on, I would check that, make sure it's inserted properly over the ears, secured under her chin, connected to the wall and to the flow meter, and everything is connected properly. And then at this point, I could also do a safety assessment of the room, make sure there's no tubing, anything in the way, anything that she could possibly trip on. If she needed to ambulate to the washroom or anywhere in the room, and make sure everything is free from obstacles that could possibly cause a fall of any sort. Okay, honey. Ava, I'm going to check your face right now. Is that okay? All right, I'm going to just take your glasses off, okay? All right, baby, can you look at me? Can you follow my pen? Can you follow it? You want me to turn it on? It's a little bit bright, okay? Let me just wait a sec. Can you follow the pen? All right, let me look at your ears and make sure, look at me. All right. Okay, can you smile for me? Show me some teeth. All right, good job. Open your mouth. All right. I turned it on. Let me see your tongue. Make sure everything is moist and it's appropriate. Okay, honey. Yeah, you can hold it. Can you look at me? Are you having any pain in your chest or shortness of breathing?
Yeah.
You don't look like you're having shortness of breath. Nope. Chest pain? No?
No.
Okay, I'm gonna check your heart and I'm gonna check your lungs, okay?
No.
No? Come on, Ava, work with me here. All right. I'm gonna just look through your gown. Let me get some underneath here, okay?
Take off.
Yeah, we can take that off if you want. All right. Okay, I'm gonna check your apical pulse for a full minute.
No. Mommy. To what? A birthday. To fire. Birthday fire. A birthday.
Okay. All right, so that was 63. Can I check your lungs now?
No.
Please, Ava. Can you take a couple deep breaths for me, babe?
Yeah.
All right, Ava, look up. Cover your mouth. Okay. All right. Do me a favor, baby.
Yeah.
Ava. I'm going to just check your lungs, okay? Take a couple of deep breaths for me, all right? 1,
2, 3.
All right, hold on, honey.
What's this one?
Okay, another deep breath. Another deep breath. Good job. And then I would just check them, comparing sides and following the pattern. Left to right and then down, right to left. Another deep breath, honey. All right, honey. I'm just going to take this away for a second. Sorry. Deep breath.
Hurt.
Another deep breath for me.
Hurt.
All right, and then I check on this side. All right, and let me check your back. And take another couple deep breaths for me.
No.
Deep breath. All right, so I do it left to right, and then down.
But back.
Okay, deep breath. All right. All right, you're doing such a good job, babe. Okay, so I'm gonna check your tummy. Let me see your tummy.
No.
Ava,
But.
when was the last time you peed? When was the last time you voided?
They did.
And then your last, so do you know, was it yellow and clear? You say yes.
Yes.
Okay, and when was the last time you had a bowel movement? So when was the last time you pooped?
Look.
Yeah. And was it soft and brown?
Brown.
Yes.
Yes.
Okay, baby girl, I'm gonna check your stomach now. I'm just gonna listen for a couple of sounds, okay? Make sure everything's working good in here. Just a little bit. It's okay, baby.
What?
I'm gonna just listen. So then I would start in the upper right quadrant of the abdomen and listen for bowel sounds. And then I would move over to the right, the patient's left side and listen for more, and then move into the lower left quadrant. Yeah. And then lower right quadrant. Okay, all right, I'm all done with this. I know. You're being such a good patient. Good job. All right, I'm gonna palpate the stomach in circular motions. Are you having any pain? Any pain when I do that?
Yes. Mommy.
Yes, honey.
Is the side flaky?
All right, we can go ahead and be all done with that. So I'm going to check the patient's upper extremities. Do you want my watch? You can have it. There you go. Yeah, that's all you, babe. Oh, hold on. All right, I'm going to look at both arms.
2 minutes.
And everything, check for any abnormalities in the skin. Just, and it looks like, Ava has a little bit of eczema, so I'd look at that. I'm gonna leave that there. And then make sure the temperature is good, the color is good. I'm gonna check both radial pulses at the same time.
Yes.
Yeah.
Pink.
Nice strong pulses.
First.
Yeah. Any numbness or tingling in
Yeah.
your no. Do me a favor. Hold my hands. Can you pull me towards you? Pull. Pull. Okay. All right. Push against my hands. No, don't punch. Push. Can you push against my hands? All right. Good job. Do me a favor. Can you squeeze my fingers? Squeeze. Good girl. Okay, let me see your hand, your fingers, and check for the cap refills.
I got this one. Mommy,
Yes, honey.
I got this one.
Okay, we're almost done. All right. Okay, and then I would move to her lower extremities.
Take off.
I'm gonna check your legs. Okay.
What?
Can I take your socks off? You're gonna help me? Thank you. All right, let me see your legs.
One.
I'm gonna go ahead and look at the legs again, just like I did for the arms, and assess for any marks or, check
Mommy.
for any sores. And again, Ava has eczema, so I
Mommy.
can see a couple little
Mommy.
marks here and there.
Mommy.
Yes, honey. We're almost done. Okay. Can you just help work with me here? And so color and temperature feels good, looks good. And I'm going to check for those radial pulses on her feet.
No.
I'm sorry, pedal pulses. Okay, actually found it. Looks good to me. Do me a favor, can you press down on my feet, on my hands? Good job. All right, press up against my hands. Can you, okay. So push your feet, flex your feet back like that. Can you do that? Press against my hand. Good job. Good job, baby girl. All right, any numbness or tingling in your legs? Say no.
No.
Okay, let me look at the cap refills.
No. Anything. Mommy.
Yes, honey. And if this was like an elderly patient in a long-term care facility, then at the end I would just make sure to check the patient for any sores. Just making sure that we check all that so that we can
Mommy.
prevent it from
Mommy.
getting worse.
Mommy.
Yes, Ava. Yeah, and so then I would just, once I'm done with the patient's assessment, I would
I got this one.
lower the bed to the lowest setting and make sure that the patient has
I got
regular safety precautions, making sure the patient has their call light, and ask, do you need anything else? Well, right now we're all done with your assessment. Anything else that I can get for you right now?
Yeah.
Yeah? You want, well, here's your water, and you have your call light, and just let me know if you need anything. I'll come back and check on you in a bit, okay? Thank you, Ava. You did such a good job. You can get, yeah, go ahead.